Moving down, we come to the femur, and the femur is a typical long bone. There are a number of points to note on the femur. The most basic ones are as follows. This is the head of the femur. There is a ball, very spherical. It's about 2/3 of a sphere, very spherical structure. And this forms the ball component of the hip joint. This slots into the acetabulum. Okay, this is known as the head of the femur. And typically, all heads sit on a neck. And the femur has this extended neck. This is the anatomical neck of the femur. And this section here is probably the thinnest part of the femur and is the most commonly fractured portion. At the end of the neck, we have this large mass of bone here, known as the greater trochanter, and a smaller mass of bone sitting underneath the neck, known as the lesser trochanter. The greater trochanter and lesser trochanter are there for the attachment of muscles. The lesser trochanter is buried deep within the thigh musculature, but the greater trochanter can easily be palpated on the outside of the hips. And again, this becomes an important reference point for certain soft tissue structures. Spanning between the greater and lesser trochanter, we have two lines, two ridges. Anteriorly, we have a line called the intertrochanteric line, the line between the two trochanters. Posteriorly, we have another line which is more like a crest, which is known as the intertrochanteric crest. And again, these are for the attachment of the hip joint capsule and for ligaments. On this diagram, we can see the whole femur, anteriorly on the left here and posteriorly on the right. So there is our head, there's the neck, there's the greater and lesser trochanters, there's my intertrochanteric line. Over here, the posterior aspect, this is the intertrochanteric crest over here. Okay, this is known as the shaft of the femur. This is a typical long bone, and all typical long bones have a shaft or a diaphysis and expanded ends known as the epiphyses. Yeah, this is the shaft, and on the anterior surface of the shaft there's not much to note. It's fairly bland, it's very smooth, and that's because a muscle, one of the quadriceps muscles, attaches directly into the shaft, and because of the broad contact area, it doesn't leave any ridges. On the posterior aspect of the shaft, however, we have this line here, and this is known as the linea aspera. And again, the linea aspera is for the attachment of a number of muscles. The adductors, part of the hamstrings, and part of the quadriceps wrap around and attach to the posterior aspect of the femur here. The shaft, for the most part, and the linea aspera are not palpable, they're too deep. But when we get down to the bottom end here, we get to two large masses of bone known as the condyles. There's the lateral condyle there and the medial condyle. These are two huge masses of bone. So again, there's the medial condyle, there's the lateral condyle. These are large masses of bone that form the articulation below with the tibia to form the knee joint. The condyles themselves can clearly be palpated, and on each condyle we have a point known as the epicondyle. And there's the lateral epicondyle, and over here we have the medial epicondyle. And the medial and lateral epicondyle almost feel like two tubercles on the lateral and medial surfaces of their respective condyles. They're the highest points of the condyles themselves, and anatomically they're important because they provide a reference for the attachment of the medial and lateral collateral ligaments of the knee. So again, these are palpable points. In between the condyles, we have this area here anteriorly and this area here posterior. This is known as the intercondylar area. It's the area between the condyles, and this intercondylar area is for articulation with the patella. In the medial condyle, at the top of the medial condyle, there is again a small tubercle for the attachment of a section of adductor magnus. This is known as the adductor tubercle. And again, The adductor tubercle is palpable and is an important reference point for some of the soft tissues. These are not all of the key bony points on the femur. These are the first ones that we're going to be looking at, palpating. But as we start doing some of these soft tissue structures associated with the hip and the knee, we will identify more bony points. They'll be covered in far more detail.